Hey everyone, my name is Dr. Jessica Lee, and I'm here today with Dr. Tiffany Bradley, and we are wellness chiropractors in Winston-Salem at Twin City Health, and we are really excited for you guys to join us for the next part of our pregnancy series. Today we are talking about the third trimester, and we're really excited to hit some of these topics with you guys and just really inform you, empower you, educate you guys just on the incredible mom that you are.
We are so excited to be doing this series with you on pregnancy because we believe that you are empowered. We want to empower you to make the choices, know that what choices you have, because you're making a human and you're a superhero, and we get to be on your birth team and support you. And that is our goal. No matter what choices you choose, we just want to always support you in them.
Absolutely. So we're going to get started.
Yeah.
And here we go. Oh. Third trimester and delivery. So that's what we're talking about today. Let me just, sorry, y'all. Always having some technical errors when we first get started. Okay, so the third trimester. So you guys just went from second trimester, and then you're entering third trimester, which is somewhere around 27, 28 weeks forward, all the way to delivery. And in the third trimester, typically, the reason I put this slide up is because some of your symptoms might start coming back. Like, for most mamas, the second trimester can be pretty blissful in terms of like nausea going away and you're sleeping a little bit better and these sorts of things. So I just want you guys to be aware that some of these things can come back. And then we also want to go through some remedies, which most of you probably are already doing, but just to reiterate a few things and help empower you when it comes to some of these symptoms. So for example, headaches. Dr. T, if you start to get a headache again, what are some common things that we can do to help with that?
You definitely want to, we talked about magnesium in the last video, so you definitely want to continue to take that magnesium. It helps oxygen get to the baby. It will help relieve some of your headache, your blood flow to your brain. Also drink lots of water. I can't express that enough. I know that you must feel like you're drowning sometimes with how much water you have to drink when you're pregnant. And then you don't want to drink it because you have to pee more. But listen, it is still so important. You can also drink some lemon water to get some electrolytes in there. And then also getting adjusted by your chiropractor can also alleviate some headaches as well.
So true. With nausea, so this might come back as well. This is not the best symptom, I would say. So you can refer back to the last video to go through some of the other ideas that we had for you, but moving forward, we have some new ideas as well. So for nausea, this can also be due to a drop in blood sugar levels. So again, making sure that you're getting enough protein, getting enough food and snacks throughout the day. Yes, eating just those whole healthy foods that we talked about before. But just again, because you're still growing that human inside of you, they are growing, they require more food intake. And a lot of times I know it's hard for moms to get that volume in, the amount of food that you might need. So again, always snacks throughout the day, maybe small snacks if you can.
Or bubbly drinks like
drinks. We got ginger and tea and that sort of thing as well. With heartburn is never any fun, but that can be due to postural changes. So as you're growing up front, you start to slump, right? So postural change. And what can actually help that is getting adjusted. You can actually adjust the spine to help reduce pressure on the nerves, and that can actually help relieve some heartburn. Same with constipation and diarrhea. So these are actually, I would say constipation is probably more common than diarrhea is, but like Dr. T was talking about earlier, when it comes to diarrhea, just making sure that you're super hydrated. She mentioned lemon water and electrolytes, but you can also do coconut water as well. It's probably one of my favorite drinks to do. And then just half your body weight in ounces as best as you can, or maybe even more, especially if you are experiencing diarrhea. And then with constipation, you can also do magnesium to help flush that.
And there's also Smooth Move tea by Traditional Medicinals that we really like. That can help. And that's really good to have after delivery as well. The Smooth Move tea, it just helps as you're healing, keep everything looser down there as well. Cramps and stomach pains, you might start experiencing some Braxton Hicks as you get closer. I know that you're aware of that, and continue to talk to your midwife or your practitioner about those as well. Pelvic pressure, just even the increase of growth, baby's gonna have a couple little growth spurts in your third trimester as well. You are gonna feel some more pressure as time gets closer. Also on your bladder, and we'll talk about positioning here in a minute. and then backaches and pains, continued growth. You're having a weight just grow in the front, and your center of gravity may change as well.
Yep.
And swollen feet, varicose veins. Yep, go ahead.
So when it comes to swelling, it's really because your blood volume is changing. It's increasing a lot. So your fluids definitely might stay a little bit more stagnant in your body. So that's why swelling happens. Again, if you can, some of the best things that you could do are just try not to stand on your feet too long, prop them up at the end of the night. Some of those things to help get things moving. Also, like Dr. T mentioned earlier, magnesium is also really good for blood flow. So if you have magnesium, definitely just be taking that because that can help with movement and with some swelling. And then the last thing is breast changes are going to be normal throughout this time as well. I also wanted to just mention some other things that might be a little bit more common during the third trimester is you'll be going to probably see your midwife or your OB a little bit more frequently, especially as you're growing into the 30 weeks. And so they also would be checking on the baby more. So making sure that they're gaining weight, their heartbeat, but hopefully your OB, your midwife is also talking to you about fetal positioning.
Yes.
And that is super important. Just make sure you ask them if they haven't mentioned it, because at this point, the baby should be settling into their, I guess, head down, their final position, if you will. And so they should be starting to move around into that position. Definitely, I would say about 30 to 32 weeks is when we should have a good idea of really where they are. But at 27, 28 weeks is when they start to actually move into position. So just make sure that you guys are asking your doctors about that. There you go. Things to remember is just to, again, have those snacks on hand so your blood sugar doesn't drop, so the nausea doesn't come back. If it is, again, there's other remedies as drinking tea. There's acupressure points that you can do right here. So just make sure you have those on hand as well. Getting in your adequate protein for growth for both you and baby, staying hydrated, as we mentioned. I also did a decreased caffeine. That's really important in the third trimester just because caffeine can actually stimulate your adrenals to release cortisol. Cortisol is our stress hormone, and stress hormones, the cortisol can actually decrease your labor and contractions. So trying to get that out because it will stall things. And then that's why I also mentioned decreasing your stress if you can.
Staying calm and collected. So next we have positioning, and so there's a lot of terms out there, and what's awesome is we have pictures to show you the different positions that the baby can be in as they twirl and dance and try to get in position. The top one on the top left is the transverse position. And that's when the baby is all the way like right to left, like how you see the baby's back. And then the one on the top right is the oblique position where baby is in one of the their head is in one of your hips and their butt is either coming on either side in your ribs. This is also the position you might feel them kicking your ribs a little bit as well. And it can be uncomfortable. And then the one on the bottom left is left occiput posterior. So this is a position that moms can deliver in. It can be painful because the baby is what you would call sunny side up. So the baby's actually facing the front just as you face the front of your body. The ideal position is the last one on the bottom right, the left occiput anterior. So when you hear anterior position, the baby's actually facing your behind, and that is the most ideal position because their head can move as your sacrum, which is in the back, opens up and they can get through the canal much easier. I know that we also talked about right and left. Left is more ideal because there's actually a little bit more room on the left side of your womb. On the right side, you have things like your liver. It's a little bit bigger. It makes there's just less room on the right. So ideally, baby will probably be on the left. Doesn't always mean that's the case, but it's common. So there are different types of breech. So when you see the pictures here, they're great pictures. So frank breech, these are the most common. There are different types. But the frank breech is when the baby's butt is down into like going towards the canal, their head up, they're not ready for delivery, and even their toes and their feet are up towards their head. That is a very frank breech. And then the next one is the footling breech. It is what it sounds. So they're going feet first down the canal, and they're still head up towards your head. And then the last one is the complete breech, where their bottom's down and their feet are also down by their bottom as well, and their head is still up. So these are all most common breech positions. Baby, I want to remind you, baby can turn in an instant. Some common reasons why baby might be breech are the placenta positioning. So the placenta could also be down where the canal is. Like even if they're head down, the placenta can be there blocking it. And the baby naturally does not want to go on top of the placenta. Another position the placenta could be is in the top right near the liver, again, constricting more space there so baby can't actually move around to get head down. So we want the placenta to also move and get in position with baby. And then the last one is uterine ligaments, muscles, and bones. If they're imbalanced, this is very common. If they're imbalanced, that's what constrict baby's movement. And that is what chiropractic care can help with. We work with the bone, muscle, and ligaments to help balance as you grow and as your body produces relaxin in your hips, so that you can have a nice pelvic bowl and in the most optimal space for baby.
So true. So let's go over some ways though, some other ways and things that you can do at home to just help yourself with keeping your pelvis open, relaxed, and low back muscles as loose as possible. You can do exercises. So if you haven't been exercising or anything like that, walking is always going to be a great thing, and it's no better time to start than now. So just always start 30 minutes a day. Recommend going outside for fresh air. You get some vitamin D as well, which will help boost your immune system. It doesn't have to be strenuous, just that motion in your hips and your low back can keep things loose.
And even curb walking.
Curb walking.
So that the having one foot on a curb and one foot down lower, and then doing both sides. But that can get some laxity in those hips too.
And then sitting. So we have an exercise ball there, picture, but sitting on an exercise ball will actually help you open up your pelvis and your hips. So you wouldn't keep your hips narrow. You would actually keep them wide. Your hips should be higher than your knees, and that can help open your pelvis and your pelvic bowl. The butterfly stretch, you might used to do this in elementary school or kindergarten or something, but you put both feet together and you actually would flap, pretend these are your legs. You would flap your legs like a little butterfly, but again, that keeps your hips and your pelvis open and relaxes those ligaments through there. And then you want to avoid any sort of reclining or a lot of things to the back, because when we're leaning forward, this allows the baby to have more movement and allows them to drop into a better position, such as the head down position.
And gravity is on your side.
Gravity's on your side.
So I just want to remind you guys, we are doing this video to empower and inform you. This is not individual medical advice as we go into the next positions and the sources that we like them. Excuse me, the sources that they come from. So just a reminder, always do your research. Ask your midwife, ask your OB what is right for you. So one of the poses I like, it comes from Spinning Babies. There's spinningbabies.com. You can check them out. They have an awesome program. If you know your baby's breech, definitely check them out. So the first one is the inversion. As Dr. J mentioned, you would have, the inversion's hard to explain, but you definitely would want to do this with a partner present. You don't want to do this alone. And you would end up propping your knees on a couch or a chair. And then you would actually bring your head down on your arms down on the floor. It's almost like a downward dog, but on your knees. And your knees are positioned outward so you can open up your hips while you're doing it. But like I said, you definitely want a partner present. It's hard to get into. Your belly can be in the way. You want your hips to rest on the couch. So check out Spinning Babies for that. The next one is the mile circuit. That is also a good one. They have a series of 3 different positions to do an exercise for a certain amount of minutes. Check out them. And water. Water is so awesome because baby is basically swimming in your tummy in water. When you go into a pool or water as much as possible, like the more you can, that helps baby float when you float. So that helps baby create more room. Again, we're taking gravity and we're using it. So we're going anti-gravity with a pool or water. And then the last one is pelvic tilts. A great example of a pelvic tilt to truly open up those hips is doing cat-cow. We did show a picture of that on our last one. It is where you get on all all fours on the floor. So you're on your hands and your knees, and that's where you arch your back a little bit, try and stay neutral, and then kind of let your belly hang, and you do almost like a wobble, but on the floor. So that's cat-cow.
And then chiropractic care, Dr. T just talked about this, but looking into finding a Webster certified chiropractor, meaning they just went through some extra training and techniques to really help mom and help her have the best delivery possible. So meaning, again, we adjust the bones, the ligaments, and the muscles of the pelvic region so that the baby has the best chance of moving into the optimal position. But it's all about making mom comfortable as well. So a chiropractor that is certified in Webster's, you can go to ICPA.com to search for a Webster's certified chiropractor.
So induction, when I want you guys to know that only 5% of babies come on their due date. You want to know why? Because they come on their birthday. So there are many tricks of the trade to jumpstart labor. We wanted to just, again, this isn't individual medical advice, but these are things that have been shown in research that can help sex. Sperm actually has something in it called prostaglandins that stimulate the cervix to relax. So of course that would be helpful in inducing. Nipple stimulation for stalled labor when you've been trying to labor and you can't quite, that is a great resource. Castor oil recipes. Now this is for the mom who's like 41, 42 weeks when we don't want to be induced medically. This is something that you want to try last resort. I say recipes because you want to look up recipes. I have a mom who had done mixed castor oil with almond butter or mixing castor oil with orange juice. You do not want to take it straight. You do want to mix it, so find a recipe. What castor oil does is it helps get your intestines moving and mobile, and the idea is that it helps get your uterus to contract more and get that moving. If you do castor oil, be near a toilet because it will cause you to go to the bathroom. Yes. And drink lots of water because we do not want you hydrated while you're laboring. So dehydrated. We want you hydrated. Yes. So just know that one can be very helpful, but consult your midwife or practitioner before doing it. Red raspberry leaf tea, that's a fun one. Our favorite tea brand is Traditional Medicinals. And the red raspberry leaf tea is, you can drink it all through your third trimester. There are some moms that up how much they take it, yes. Maybe even like a quart of it a day. You could drink it hot or cold. But when they up it, it's when they're around 40, 41 weeks and they're really trying to soften the cervix. That's what the red raspberry leaf tea does. What's next? Membrane swiping or stripping. This is something that your doctor may suggest as a last ditch effort to soften the cervix and get things stimulated and moving, is they do swipe the membranes. From my knowledge, it is painful. So know that. Eating dates is also a really good one. So you can do this also throughout the third trimester. What dates do is they help higher cervical dilation and intact the membranes, and they can help with a spontaneous labor. There's one study that says date consumption during the last 4 weeks before labor significantly reduced the need for induction and augmentation of labor, and it produced more favorable deliveries. So I don't really like dates, but I think I would do it if I would eat them if I needed to. It's like a big grade.
Yeah. Dates are, but a really good date recipe, y'all, would be dates with goat cheese, and then you wrap it in bacon. Yes. That's like the best way to eat a date. Otherwise, dates are not. Or chop them up in a salad, maybe.
Yeah, maybe find a recipe
rather than wrapped in bacon
outright if you don't like them.
So good.
There's not a whole lot of research behind the pineapple, but pineapple has something called bromelain. Bromelain does help work with your blood flow. It is a natural blood thinner, but it is also known to induce labor. And then the last one we talked about, the Miles circuit. And clary sage oil, if you want to rub it on your ankles, on the inner part of that bone right near your ankle. Whoop. That also can help induce labor. So these are all things you can try at home. Again, especially with castor oil, consult your practitioner.
So let's talk about C-section really quick, because even though we have birth plans and we want everything to go swimmingly and according to plan, sometimes that doesn't always happen. Yeah. And we want you guys to realize that that's okay, and that it doesn't matter how the baby comes into this world. What matters is that it is healthy and you are healthy and safe as well. And no matter what, you're awesome and you're amazing and you've got this. You just grew a human for 9 months. And so we're incredibly encouraged by you. And we hope that no matter what happens, that you feel empowered, because there is a certain mindset that comes behind. I know a lot of people that feel discouraged, maybe feel let down. They feel like a disappointment because they had to have a C-section, and that is not the case.
Sometimes sometimes they're necessary, and that's okay. Just know that that's okay, and we're here to inform you. So if you do get a C-section, there's things that you want to know in recovery and do a little bit more of. A C-section can create more swelling overall in your overall body, water retention, and that's because of the Pitocin, the epidural, and then the anesthesia from the surgery. So you're going to do your best by drinking, again, tons of water to try and eliminate the anesthesia as quick as you can. It has been shown that if you get a C-section, you could have difficulty nursing right away. So what you want to do is try your best. Grab the baby, have some skin-to-skin contact right after the baby's born. Try and get them to latch. That is the best time to do that rather than waiting. And also, it helps decrease the swelling of the breast, because if there's too much swelling in the breast, it's going to be harder for baby to get the colostrum, harder for baby to get the letdown. So do that as quick as possible. Some other recovery things.
So chiropractic care, this is more for mama to help her body recover and heal a little bit faster. It's removing any pressure off your nervous system to allow your body to heal and function as it was created to and intended to. So getting adjusted, post C-section, post-birth in general would be really helpful for mom's recovery. And we even check kids. So pediatric cares can also be really important as well. But we can talk a little bit more about that in the next video. You also want to just make sure that you're doing some supplements to help your body heal internally and externally. So you can use things even on the scar, such as like arnica gel for pain. But you can also use aloe gel as well, just for healing, or vitamin E oil to help with the scarring. So those are all some good ideas. You can also do more nutrients and supplements. So things like bone broth is actually really good for collagen and that scar healing. Vitamin C, again, protein and amino acids are going to be really good for scar healing. So make sure that you're trying to incorporate all these things into your nutrition.
And then when it comes to baby, when the baby is delivered vaginally, they get something called the big gulp. The big gulp is the natural, that's what it's called. Yeah. That's when they get their probiotics, because we have probiotics, vaginal probiotics, and that helps boost and start baby's immune system from the get-go, because 85% of your immune system is in your gut, and that's where the probiotics go. So if we get a C-section, the baby doesn't get the big gulp. So something you want to start doing right away is not only you taking probiotics and vitamin D, but even giving them to your baby in minute doses. But they'll definitely need some probiotics to start that immune system right away. A way to do that, skin-to-skin contact, actual probiotic supplements. They do make probiotics for babies out there. And then even liquid vitamin D, just a little bit. Vitamin D helps boost that immune system as well. So there's definitely things to recover. Some postpartum options, just to know and be aware of the options that are out there. Delayed cord cutting is one of them. What was that? Oh, so delayed cord cutting is cutting of the umbilical cord. So we start doing that. What that means is from 1 to 5 minutes. So at around the 1 minute mark, if you leave the umbilical cord pulsing till about 1 minute, baby will receive about 50% of that cord blood. Around the 3 minute mark, they'll receive about 90%. And around 5 minutes, they could receive all the cord fluids. Now, it is different per person. So just until you see the cord stop pulsing and limp, and white in color, and that's when you want to cut it. The most important part of delayed cord cutting is babies actually receiving the most important thing, which is stem cells.
Wow.
Stem cells are going to repair their body from the trauma they just had from birth. So that's the most important part. Another great thing about delayed cord cutting is decreasing the chance of anemia. Baby will get more red blood cells to their body. They'll also get more iron to their body and oxygen. And it improves motor skills. So once they start moving after about a month,
that's so cool.
They'll start to feel their nerve endings after about a month of outside the womb, and they'll have better motor skills. So that's pretty awesome. The next one, vitamin K shot. The vitamin K shot is more of a routine thing now. Babies don't develop in their own body vitamin K up until they are 8 days old. So in 8 days, if the baby gets cut, they don't have that clotting factor for their blood. So that's why they started giving the vitamin K shot. Now, if the baby is not going to get cut or have crazy trauma in the first 8 days of life, you don't have to choose to get the vitamin K shot. This is also why some parents choose to do circumcision after 8 days of life. But just be aware that they start doing that. They start developing their own vitamin K after 8 days, and clotting, their blood will clot as well. Something that mom can start doing is eating vitamin K rich foods like spinach and kale, even cabbage. I know that might create a gas problem, but those are vitamin K rich foods that you can consume and pass on to the baby through breast milk, because vitamin K is fat soluble, and anything fat soluble will go through to the baby through breast milk. The next one is eye ointment. Eye ointment, what that is it's an antibiotic called erythromycin. This actually is an option. This is an option that they made routine. So the eye ointment is if mom has ever had an STI, so a sexually transmitted infection like gonorrhea or chlamydia, and this is to protect the baby's eyes from getting the infection in their eyes. Now, if you know that you've never had an STI, you don't have to get the eye ointment, or if you know that you have, you can choose to do that. Skin-to-skin contact, I've mentioned. That is baby getting probiotics from your skin. It also creates a bond. After giving delivery, there's a euphoric, the hormones that create a euphoric bond between mom and baby. And then also just starting to work on latching to the breast as well.
And that skin-to-skin contact also really helps with body temperature.
Yeah.
So helping the baby's body temperature normalize as well, which is also why the vernix is important. So a lot of times this gets wiped off because it looks a little icky on the baby. But the vernix is like this white waxy substance. It's actually designed to help protect the baby while they're in utero. And this is somewhere formed around 20 weeks of gestation to 27 weeks is when it begins to form. And it is there to protect the baby while they're in the amniotic fluid. But it is also a very good, like it has lipids in it has amino acids, it has some hormones in there, but also it's really good as a antifungal and antimicrobial protection layer for the baby. So it's kind of like their last line of defense when they're coming out of the vaginal canal. So it's important to keep that on there because it does not, I guess, seep in or come all the way to the skin until after about a day, but it fully goes in and into the skin. It gets absorbed after 5 or 6 days. So super important, like if the baby spits up or anything like that, to just wipe it off with a damp cloth. When you're doing that skin to skin, it's also a really good time to start wiping the vernix into the baby's skin to help it absorb. And then there's also actually protective layers for mom as well. It actually has been shown to help with skin healing. So if you have a tear or rip down there at all, it can actually help you heal a little bit faster. So super important things with the vernix if you decide to keep that on. It's super helpful.
Our bodies are so amazing.
So amazing.
Even from birth, the baby's body it knows what to do. It's so amazing. You're designed this way. I love it. The last thing on our options here are placenta capsulation. So it is exactly what it sounds like. You deliver baby and then deliver the placenta. A lot of moms, if you didn't know this was an option, you can actually dehydrate the placenta. I know it sounds crazy, and make capsules of it. But when you do that, and for yourself, so this helps with postpartum depression. It can also help you get stem cells, and it also helps. The biggest thing is helping those moods even months after giving birth. So you'd have to send it away, dehydrate it, and then it gets encapsulated. Just knowing that's an option, because that is the one time you can make that option. You can't do it again.
The cool thing about capsules too is that you can kind of vary your dose. So if you know that your hormone levels are off or that your mood swings are high and low, you can add in an extra capsule or two to help yourself as well. But yeah, super powerful.
I know I haven't heard moms say like, hey, who have had multiple children and didn't get the capsulations, but when they did, they're like, I know it took me along through postpartum. So it's definitely a good option.
We just wanted to lastly end with you guys, giving you some resources around town here that we think are going to be super helpful for you when you're looking for midwives, pediatricians, even mom groups. So we've listed them all, and they should be linked in the comments below. So make sure you check that out.
The
websites and stuff like that.
If you want, take a picture of this slide. I'll just name a couple. The midwives and doulas. Natural Beginnings is in Statesville. That's a birthing center. There's also Wake Forest has a new birthing center at it here in town. Courtney Long, she's a midwife in town in Pilot Mountain, I think. And then also Dr. Lipscomb, he's at Novant, OBGYN, and he's an local OB. Peditrician, Triad, and Robin Hood Integrated just got a new pediatrician.
That's exciting.
Which is super exciting. Webster's we've talked about, mom groups. There's definitely a Twin City mom group. So yeah, check them out. Here's some more resources. Take a picture of this one.
Placental encapsulation is just like we talked about. There are places that do this for you. So we only listed one, but I do believe there are definitely a few more here in town, and even prenatal massage. So I forgot to mention this earlier, but prenatal massage or reflexology.
You deserve it.
Not only do you deserve it, but can actually also help with induction as well. So one person that a few of our pregnant moms have been to, I think, actually really enjoy this place. So the Essential Balanced Body Work down in Clemens is a really awesome place. Oh, and then, healing. Sorry, I was going to read that last one. The healing after the cesarean section. We talked about that a little bit, but there is a international group called ICAN, International Cesarean Awareness Network, that you can join if you feel lost or you feel like you need help or someone to reach out to, someone to talk to. It is a great network of people.
And resource you. Yeah. Thanks for tuning in, and we'll see you guys on the next episode.